Is. So our first speaker today is Tami Ryan from Wisconsin. Everybody got a chance to hear from her and talk to her yesterday. Tami, I was just wondering, for simplicity, can we call you Mike?
That makes it easier.
Okay, to introduce Mike Ryan, I'm going to let Emily take it from here.
Let's do a brief introduction. All right, so it's my pleasure to introduce Tami Ryan. Tami's been working with Wisconsin Department of Natural Resources Wildlife Management Program since 1993, with a keen interest and aptitude towards wildlife disease and wildlife health matters. She's been involved with CWD throughout her career, starting with serving on the incident command team during the original detection of CWD in Wisconsin in 2002, and through each step along the way to the present. She currently serves as the State Wildlife Health Program Supervisor and has been doing so since 2009. And a personal note that she added is that she and her husband just adopted 2 English setter rescues.
Good morning. Thank you so much for having me here and inviting me to come and speak with you today. I agree. I think yesterday was great. All the presentations that occurred set a really good foundation, I think, for this morning's discussion and information that I'm going to share with you. And I think the proper thing is that we're going to get rolling, right? We're in Montana, right? All right, so with that, I will go ahead and I guess I'll just say that I feel as though this presentation has a lot of information in it. I basically, to give you a presentation that covers 15 years worth of experience is a pretty significant undertaking. So please, I think, I tried to dig into some of the details and maybe in some cases not far enough. So certainly feel free to, interject and ask me questions as we go along. So my plan for you today is to basically walk you through our 15 years of CWD experience in the state of Wisconsin. I've divided the PowerPoint up into what I would consider as like primary phases. So we'll work through each phase. I'll share with you highlights information from each phase along the way, including the various iterations of our CWD response plan that we've had all the way through the present, which we just recently completed a similar process that you're undertaking here. So with that, this is not changing down here. That's kind of messy.
It's not advancing on me.
No, it's advancing on the screen, but not down here.
Welcome to Montana. Yeah, we just got these a couple
You guys
years
just got
ago.
electricity.
Quick point in a slot.
Really?
Does anyone know if there's a way to
That's what I would do.
Yeah.
Grab Sunny,
first?
escape out of
Just
there.
close the,
And I
yeah.
think were the other one, you were using an arrow key rather than a, I think the other presenters were using one of those other keys.
I was using page up, page down. Is that
Oh, page up, page down.
right?
Go page up or try one. There you go, back to the beginning.
It's not changing on the screen, which is I don't want to keep looking, up there. I want to look forward. Let's close it. Just try it again.
Well, that is what it is to do. If you just maybe.
Remember what the hell the next one is going to walk in. Which would be handy for me. Switch sides. Oh, that's what
But, I guess,
I never really changed it again.
No, it should work.
All right.
Changing there.
So you saw that. All right. Sorry about that. So some of this will be a little bit of review from Mike's presentation, but so as you know from yesterday that we had we conducted CWD surveillance we started in 1999 through 2001. And the reason why we embarked upon that effort at that time was that we were aware of importation of elk coming from out west into Wisconsin, and we actually had a facility up in the, around here, that had, it was an elk facility that had an animal that was a double whammy, had no CWD and TB. So we embarked upon this endeavor to do statewide CWD surveillance, but we did look at the what we knew about deer population density, and as well as where high baiting and feeding was occurring, and also around the proximity of deer farms. So that was kind of our strategy at the time. Through that 3-year time period, we sampled around 1,100 animals. And in February of 2002, we were notified of the finding of our first 3 index cases of CWD, when we were notified that 3 bucks were harvested in the previous fall. And I remember that day well. It was definitely kind of one of those days that, like was on that No Accident film yesterday, when Julie Langenberg mentioned that as a day that you remember. I definitely do remember that as well. At the time, I was serving as a regional wildlife biologist and our bureau director, and we were all in this statewide conference, and our bureau director came and tapped us all on the shoulder and said, come here, come on the hallway. Everybody in the program sees, you know, all the regional biologists get up and the bureau director go out in the hallway and they're like, something's up. and that was the news that we got that day. So it was definitely not welcome news. And at the time, it was also the first detection of CWD in a wild cervid east of the Mississippi River. And it was quite a blow to us, you know, at the time, we were very concerned. I mean, as it was mentioned, you know, deer are integral to the state of Wisconsin. They are, you know, deer hunting is a really important culture of our state. At the time of detection, it was a $1 billion annual industry economic impact, and around 700,000 hunters participate in deer hunting at that time.
So Tami, did they ever discover where it came from?
No, but they did investigate. They did do investigations into it, but it was never something that we ever identified. But like Mike mentioned yesterday, we did have a law enforcement initiative where they were, you know, seeking to try to find the answer. But as we say, to this day, there's no smoking gun.
So do they use urine there as a cover scent or as a tracking?
Urine-based scents are used in our state, yes. We do not have.
Or as a cover scent?
Oh, more for an attractant, yes. And also of those 3 animals, 1 out of 3 of them had clinical signs of CWD. So that's the area of the state where it started. Our response was pretty immediate and intense, and we held a public meeting right away in the area where those animals were found. It was one of the largest attended meetings that we've ever had. About 1,400 members of the public attended. We invited experts from out west. Dr. Mike Miller was there to help in that endeavor and to share information, as well as kind of share with that local community what our concerns were and what our response was going to be. We unveiled an aggressive plan of action at that time, and even on that day in the hallway of the meeting, we were issuing permits to landowners for deer removal.
Well, it says Vikings back there.
That's the local, high school mascot, I guess.
It's not purple.
Right, that was not Minnesota, that was Wisconsin. So that was, you know, February of 2002, which really just kind of kicked off the next five years of our response. And so shortly after that detection, we implemented an incident command structure. We basically overtook an office facility like this here in Montana, took it over, created an incident command center, and we developed a 10-mile radius surveillance area. and went to trying to get samples. So, we had our index cases now. We were in the process of doing assessment surveillance, trying to learn what we could about distribution.
Did you with the DNR have experience in doing incident command stuff, or did you have to bring in experience from elsewhere because there's a lot involved with the incident command structure?
There is, and we did. Not everybody involved at the time had the incident command training, but those that were like heading up, like our incident command chief did, and so did others, like the various planning section chiefs.
Okay.
So incident command, we had enough people in the process to help, facilitate that kind of operation.
And those people were DNR employees?
Yes, they were. Yep. In fact, our incident command leader was the Southern Wisconsin District Wildlife Supervisor.
Tammy, so in that context, why does incident command training come to DNR in Wisconsin? Here, it's tied to fire management. Is that what it's tied to?
That's the main reason why people had incident command training was, because of fire.
So your DNR also works with fire stuff, does fire stuff too, apparently?
We do, yes.
Okay.
Law enforcement, forestry primarily,
Right.
but there's some wildlife staff, not everybody.
Yeah.
It just depends upon the position and your location.
Yeah. We have a different state agency that does fire stuff for
Okay.
state fires.
So let's see. So we had our 10-mile radius surveillance during this time. Then during March and April of 2002, we collected 516 deer, and of which 15 of those tested positive. So as you can see too on the map on the right, and I know you saw this yesterday, but the deer were what we found in the positives anyways, that they were not uniformly distributed as a cluster of positives. The prevalence at that time was about 2.9%.
How were those deer collected?
Through department sharpshooting, which I'll get a little bit more into, but that's okay. So what we know now that we didn't know then is that the disease was likely present for about 20 years prior to this detection. Okay, so shortly after that initial surveillance that we did, an interagency task force was formed, and this interagency task force basically developed a plan, management plan, that informed that year's response. So they developed a plan that had a goal to eradicate the disease. That's a really important point of emphasis. That word eradicate is something that, 15 years later, or even 5 years after, we certainly look back on that, and that was probably one of the biggest challenges that we created for ourselves was with that word and with that goal. But nonetheless, that's what it was. We were advised, hit it quick and hit it hard, and so that you can get rid of the disease. So that's what we did, and we sought to eradicate the disease from the state.
When you say interagency, it was the DNR and what other?
DNR and the Department of Agriculture, the Department of Health. We also had USGS and university. Mike Samuel, you were involved with that interagency, were you not? Yep. So, through this process, this team developed these management strategies, and those management strategies were advanced through an emergency rule process. So we had the authority then to implement these strategies at that time frame. So the strategies of doing extensive testing to determine the geographic distribution of the disease, yes?
So when you did your first testing there, did you say 2.9% is what you determined? And so at that point, you thought maybe you could eradicate it?
Absolutely. And when you see a cluster like that too, then you can focus in on that and put the fire out, as they say. Yes.
Tammy, when you said to implement those management strategies, you have to go through your commission?
We did. So first I'll lay out just the strategies and the process. So the strategies, for extensive testing around the known area of infection, as well as seeking to depopulate the known area to be infected, and then looking to minimize the population around it. And then we also sought to ban baiting and feeding statewide. As everyone knows, baiting and feeding is a way to reduce spread of disease. And then we also wanted to embark upon research that we could inform, future management strategies, because at the time there really wasn't a lot that was known about CWD.
Tami, are you going to speak at some point about funding? I know you did a little bit yesterday, but as this started to roll.
Yeah, I will. And then I have some additional information that I could pull out later too. But so then we moved on to the process of getting our approval to implement these management strategies. And so we had to, in order to implement, we needed a legislative authority to do so, and we needed their approval to implement those emergency rules. So they held a special session in May of 2002, and through that special session, they did authorize us to shoot deer from vehicles, use aircraft, which we never did, but they did give us that authority, as well as approve supplemental appropriation to pay for CWD management, and they authorized that we could extend these emergency rules as needed. So then, following that, in June of 2002, our Natural Resources Board, which is like your commission, I believe, which is our policy-making board for the agency, did approve this package of emergency rules, as well as the establishment of the zones that we utilize for our management. So we had a stratified approach. This isn't the map from 2003, but nonetheless, just to kind of delineate. Laser, there we go. So imagine there's a small area circle inside this circle. So that was the disease eradication zone, which was then surrounded by an intensive harvest zone, which is then surrounded by a herd reduction zone. So that was like a 3-tiered stratified approach that we had. So in the disease eradication zone, that was where we wanted to eradicate, and then subsequently reduce deer populations as from there on out to try to contain the disease and eradicate here and then prevent spread.
Is there a second eradication zone down on the
There is. So this is kind of out of sync, but so we have 2 areas of infection in Wisconsin. This one down here, the Eastern Disease Eradication Zone, didn't come on board until 2003, but we do ultimately, over the long haul, have 2 areas of infection that we were seeking to address.
Yeah, you talked about using aircraft to depopulate.
We had authority to use aircraft. We never did.
Oh, okay. But you collected all the carcasses, or you didn't leave them lay on the ground?
No,
Okay.
All the carcasses through our sharpshooting efforts were either given to the landowners where we received permission to shoot, or to donate it to the food pantries.
Did you work with other states too, like on the southern border there?
Mm-hmm.
No.
Yeah, the state of Illinois, we worked very closely with in those early years. We still, collaborate through planning to this day, but at that time it was a much more pretty strong collaboration at the time.
So those deer you harvested, did you test any of those?
We tested all the deer that we harvested.
Okay.
Yeah. And it really wasn't harvesting, it was culling.
Right.
Yeah.
Yeah.
So your governor called a special session of the legislature?
Yes.
Okay, and then the legislature did special appropriations money for this?
They basically gave us the authority to utilize the funding that we had for the purposes that we needed. Kind of redirection of funding.
Oh, so it was still DNR funding,
Yes.
but they gave you approval to
Correct.
shift 75% of it, right?
Right, exactly, yeah.
Okay.
Mhm.
Tami, did you, in terms of giving carcasses to landowners or food banks, you held those, or they held them until test results were available?
So the landowners held them until, or we held them in our efforts through semi-referred trailers that we had them frozen basically, or else and then the meat pantries, the meat processors stored them in their freezers until they either stored them and waited to process them, or they processed them and waited for the batch results.
So you would store hundreds of carcasses in these reefer things, you had them all labeled and then numbered until you got, it took, what, 12 days? Or how long did it take to get the information back on the test?
Well, it was a very, very time frame from the beginning to the end. And I have a slide that shows that, the time frame from the beginning to the end, but it was like 95 days at that time.
Wow.
Yeah.
Okay. Wow.
Which, you know, that's like the overall, but at the time, in the beginning, we were cutting off deer heads, transporting the deer heads to a location, extracting the tissue, then submitting the tissue to the lab, and then waiting for the lab results. So the biggest part of it was storing and freezing all those deer heads, hauling, you know, storing and then hauling, and it's just not an efficient process. And when you had as many heads as we were collecting, you'll see the sample numbers that I'm going to give you. It's a lot of deer heads.
Well, I'm interested
So
in that.
over time, we improved efficiencies, and around 2007 is when we really embarked upon just doing lymph node extraction in the field, and more frequent trips to the lab to get those processed, and so we've gained efficiencies over time.
Just the logistics of storing hundreds of carcasses, I mean, you must have had 15, 20, or 50 reefer trailers, I would imagine.
I'm not sure how many we had, to be honest. I mean, we had one in the eastern area, but in the western area, I think we had 2 or 3.
Okay.
We had what was referred to as a frost and toast program, where we kept the carcasses frozen, and then when we got the results back and we knew they were positive, we needed to dispose of them, they were incinerated.
The lab being, I mean, IEC, Eliza, was it your lab?
It's Wisconsin Veterinary Diagnostic Lab on the campus of UW Madison that does all of our testing.
Did IEC or?
Both, Eliza and IEC. Okay, so I guess the other point that I would share in this regard is that the way that the lines were drawn on the map was, so where there was the known three positives, or the index cases anyway, we drew a line 4.5 miles out, and that was that defined the eradication zone. And then 9.5 miles out from those index cases defined the intensive harvest zone. And then 40 miles out from the index cases define the herd reduction zone. So we then embarked upon a statewide disease detection surveillance in 2002. And during that time frame, we sampled 40,000 deer. So like I was saying, that's a huge number of deer heads to process and work through, which is certainly attributed. And then getting all those heads from across the state to a central location, certainly attributed to that time frame. Let's see. So from there, I'd also share with you, I was mentioning that southern disease eradication zone on that previous map, and that was kind of correlated in time with the Illinois detection. So up along the northern border here is where they had their first case, and then we were just right across the borders where that southern area of Wisconsin is. And so that happened. Illinois detection was in November of 2002, and ours was in November of 2003. And ours was a 6 to 8 year old doe.
So, if I understand correctly, as your surveillance also brought in hunter harvested deer, was that a required testing? Were those hunters required to present those deer?
They were in the eradication zones, and then we had various iterations of that over time. We in fact had county-wide mandatory testing as the years kind of progressed, because we weren't getting enough samples from primarily the southeastern part of the state, where that other southeastern disease eradication zone was. Completely different landscape than the west. The western area is heavily hunted, higher deer density, more deer range in that area, whereas in the south it's much more scattered woodlots, agricultural, lower deer density, harder to get samples. So we we went mandatory there and countywide level.
Did you also offer additional licenses to hunters?
Not additional licenses, so I'll hit on that in a little bit.
Okay,
Okay. That's okay, that's good. All right, so let's see, I think I covered that one. So after we completed our 2002 detection surveillance and collected 40,000 samples, we then had an environmental impact statement process. So we basically, all those management strategies that I identified and the emergency rules and such that we implemented, we then had an environmental impact statement that went out to the public for basically review. It was our way to assess all those proposed actions for depopulating the affected areas, reducing the herd in the surrounding affected areas, and banning baiting and feeding statewide. So we held public meetings across the state for that. And that environmental impact statement process then informed a new CWD response plan that started then in 2003. So this would be like our first officially adopted CWD response plan with this goal of minimizing the negative impact that CWD has on our both wild and captive deer population, deer and elk populations. We did have elk in state at that time. A lot of people don't know that we have elk in Wisconsin, but we do. Very small herd up in the northern part of the state. So, but essentially, this is our goal. We wanted to, do what we could to protect our state's economy, the hunting tradition that we have, all the landowners out there that offer hunting opportunities or like to use their lands for hunting themselves, as well as obviously in the long run having a healthy wild deer and captive populations.
Then or now, has there been a livestock voice or an agriculture voice speaking to DNR's efforts on CWD? Or have they been, is that perspective mostly quiet?
So now, I mean, I could say with the present time, we are very much in a collaborative state with our Department of Agriculture and CWD. I can't really, I'm thinking back to this time frame and I honestly don't know. I mean, they certainly were aware. CWD is a reportable disease. There's at least information sharing. The one thing that they certainly were aware, and one thing that they did do was, I think it was 2005 or 6, was in response to what was happening within our state, they did establish new rules for the captive service industry in Wisconsin that was more of like a herd health certification type policies and procedures for enrolling in herd health assessments and kind of guiding, their practices of movement within the state as well as out of state. They do have, so they did definitely have a response, I guess, to finding CWD in the wild.
Is that alternative livestock game farming, is that the reason ag is involved now, or is it some of the science we talked yesterday about forage and bale and transport of aggressors? What's motivating?
The primary motivation is the industry. Our industry, the captive service industry in Wisconsin, is pretty well established. And I know this came up yesterday, and I could go there now if you'd like, just to show you.
Abby, was there discussion with the ag people about double fencing, or did they double fencing on those alternative livestock ranches?
What do you mean by double fencing?
Double fencing.
Oh, fencing,
Double
I'm sorry.
There is actually some recent discussion about fencing and double fencing that kind of came out of our just most recent response plan process. And so there is interest and collaborative interest to look at fencing rules for CWD positive facilities and requiring double fencing in those situations. That is a new action item that came out of our most recent CWD response and review process. So I'm just going to pull up the map.
Tammy, as I recall, the public health people were involved from the beginning on this too, as part of the interagency.
They were, yes.
team. I think
Yep.
that's maybe an important thing to consider as well.
Yeah, and I did mention that Department of Health was on that interagency task force, but yeah, they too, and there'll be more that I'll share about that here in regards to actions that they've taken. Let's see. Here it is. Oh, why isn't that showing? What? I can see it on my computer and you guys can't see it up there.
Everybody gather around.
I'm sorry, this isn't working out so well. Well, shoot.
Is it another slide in your
No,
presentation?
that's
Oh.
why I see it. I thought I pulled it up on our website so I thought I could toggle back and forth between our website and the presentation while I was up here, but it's not working.
I just saw your mouse up there. Yeah, so are you
Hit
there?
escape words.
That's weird.
And hit escape and it'll take you out.
Now I can't even see
She's
the
not
mouse.
even in the phone.
Probably not.
No, from the left.
I'll go get help.
It's one of the early computers made by Mattel.
And it's like black. I can't even see it.
While she's looking for that, did you get any feedback from the anti-Henry community?
So I'll tell you guys that I have,
Not that I recall, most of the negative stuff was actually from the hunters.
I have 73 slides
Great.
on all CWD and then additional slides on recent research. So, and I'm on slide 13.
Great. You have till 3. What time's your plane tomorrow?
So Tammy, a farm herd goes positive and it is not depopulated necessarily, so that's when double fencing discussions come in, evidently.
Well, yes, that's when it would come in, yep. And this is not something that we do presently, but it's something that was identified as a new action item and something that we've recently just,
I would think with a positive herd, the guys just putting money down the drain to feed.
So back in those days, there was a compensation for people who had, and the compensation was
okay.
pretty substantial from what I recall.
Yeah.
So, yeah, well, so we joke sometimes, you really, the way you want to make money and having a captive game farm is to have disease and get the indemnity,
Yeah.
so.
So the state compensated the
I
producer?
believe it was USDA was compensated.
Oh,
Yeah.
really?
So did Montana.
Yep,
Oh,
USDA.
really?
Yeah.
So in the early days of CWD, there was a lot of federal funding. And that federal funding went to states and to ag departments with CWD, and the ag departments used it for basically indemnification payments for when they depopulated. So they basically got a price per animal price payment. And then we, as a state agency, got funding then for our management responses. Overall in the state of Wisconsin, from 2003 to 2011, we received a total of $6 million, of which 3.6 was federal earmark. So there's Senator Cole actually established an earmark fund that no longer exists. Then USDA also had this tiered funding, and we were a tier 1 state, and we received 2.3 million total. So overall, we had a lot of federal funding in the early times. Okay, so here's that map of the cervid farms. This is from our Department of Agriculture. Starting with the key first, because I'm going to have to scroll up, but you know, the stars are preserves that are infected but are not depopulated. So, and essentially they're hunting preserves, and the reason why they're not depopulated is that hunting preserves are for removing animals and hunting animals, and so every animal that's harvested and removed from that property is tested. And then the non-enrolled farms, that basically that means those are the, so that herd health program that they implemented. Not everybody has to enroll in it, but if you want to do certain things with your cervid practices, you need to be enrolled. And then the red dots are past positive farms that have been depopulated, and then the other dots are just all the currently registered farm-raised deer farms. So this farm-raised deer is kind of a broad term that they use for cervids in general. So it's not just white-tailed deer, it also includes elk and other alternative livestock.
So I assume the hunting preserves are game-proof fences, or supposed to be game-proof fences anyway?
They are supposed to be,
yeah.
So I'll just slowly scroll up so you can see. So here, obviously this is the southern part of the state where we have CWD. And you can see that we have a lot of deer farms. It's amazing. It's quite the industry.
So Tami, for those that were depopulated because of CWD, is there any requirement to maintain fencing long-term, or
No.
how does that work?
There's no requirement to maintain fencing long-term.
Is there an effort to like work with those landowners to try and convince them?
No, in fact, I have a good story to tell on that too. It's coming up. We're good.
So Tami, are these deer farms for hunting, or are they for?
They're, so the hunting preserves are definitely hunting, but a lot of times the operations are that they might have multiple facilities, and so they'll have a breeding facility somewhere, and then they'll have a shooting preserve somewhere else, and then they'll use their breeding preserve to populate that hunting preserve, or they might just be a breeding preserve for the purpose of providing stock to other farms.
Yeah, it just seems, I mean, if the densities are 50 deer per square mile wild, it seems interesting that they have enough business. Like, there should be enough opportunity.
Thanks for that break, Tami.
Yeah.
That's really interesting.
Okay. All right, so let's see. 2003 management plan. We just reviewed the goal. So it has these as the primary management objectives. Again, looking at targeting the geographic distribution and prevalence of the disease, investigating the possible origin of the disease, minimizing spread, enhancing scientific information, also using the best science information to guide our management. So adaptive management is definitely the name of the game. And then providing the public with timely information. So those are the primary objectives at that time.
I can't remember, was there CWD in any of the deer farms before the wild one showed up? Or was that the wild one the first incident in the state one?
I can't remember. I think around that same time, there were 3 deer farms that were all interconnected. I think it was wild first, and then captive was like right up thereafter. I could confirm that. I mean, I really shouldn't be. I can't say for sure. I don't remember.
Okay.
As many tests ago.
That was so long ago.
Yeah, right.
15 years. All right. So then, so those are the management objectives, and then these are the primary management actions. So we did conduct surveillance throughout the state. We worked really closely with the Department of Human Health on monitoring cases of Creutzfeldt-Jakob disease, as well as providing information to hunters basically on consumption of venison and safe handling practices for avoiding, you know, the parts of the carcass that could contain the prions. We provide, to this day, we provide our Department of Health data on hunters that have chosen to consume CWD positive meat. Just as a way for them to kind of monitor, and, you know, if sometime down the road a CWD case should arise in the state of Wisconsin, they can look at that database to just see if there's any correlation.
So do you continue with the testing right now with hunter harvested animals?
Do we to this day? Yes, we do, absolutely.
Okay, so then
I have our
okay.
most recent 2016 in review, just to kind of give you an idea of how it is that we approach
Is that
surveillance.
statewide?
Yes.
Okay, so they get a result back if they harvest a deer?
Yep, yep, they do.
Tammy, I'm sorry, so if I understand,
But it's voluntary.
DNR
Yeah,
is
it's
a
voluntary.
human health
Yeah, there's
names
no
of
more
people that have
mandatory registration.
chosen to consume deer. Is there an agreement in place with that hunter that information can be exchanged? Or is that just, okay, is that just public information?
It's information that's held in confidence. I mean, it's not like it's not records that are open for like open record requests.
And the hunter knows that either through program announcement or specific communication to that hunter that exchange has happened?
They do, yes.
Okay, thank you.
Tammy, you might just clarify, because I don't think everybody heard it, but you're not testing every harvested deer in the state of Wisconsin every year, correct?
No, we're not. It's a strategic approach. So we have surveillance goals that we identify on an annual basis, and then we seek to achieve those surveillance goals through hunter harvest. Yeah, that would be a lot of animals to test on an annual basis. Thank you, Mike. Okay. Let's see. So also in 2003, once we had a formally adopted management plan, we began maybe re-upped or renewed our research endeavors in the world of CWD, and created an interagency health and science team. And so that team would meet on a regular basis just to kind of discuss the state of knowledge of CWD and all the respective agencies, and working together on identifying and supporting and funding, in some cases, research. We really embarked upon better outreach and communication through all the various tools that you can think of at the time, and then also continued our ban on baiting and feeding. And when this plan was developed in 2003, it was before our detection in the southeastern part of the state, but nonetheless, we assumed that at the time CWD was isolated to the southwestern portion of the state. So some of the primary disease tools that we used included our deer population and hunter harvest. So we really relied on hunters to be our primary deer population reducers. We also did offer extensive special seasons and opportunities, and I have a little bit more detail on that here shortly, as well as we started using agency shooters in specific instances. So thinking about our expanded season structures, this is just specific to gun season. So our archery season to this day still starts in the middle of September. So this is, and then runs through early January. There's been different iterations of that, but nonetheless, gun season, at least in the early years, gun harvest is higher than our antlerless harvest. And so we sought to offer more hunting opportunities in general, but definitely more gun hunting opportunities. So we went from, having a very traditional 9-day gun deer season in the southern part of the state to offering 100 days worth of gun hunting in the southern part of the state. And as you can see here, as each year goes along, we did reduce the number of days over time. The things that I guess I would point out here is that this gun season structure, starting in October 20, and anywhere in late October is the rut period in Wisconsin, so it's definitely a time that previously was kind of reserved for archery hunters only. Then you introduced gun hunters, and that really had a significant effect on population and harvest and population reduction. We also had Earn-a-Buck, which is a tool that that required all hunters to harvest a antlerless deer before they harvested a buck. And so we had that in place, and it was also unlimited, meaning that you could get, if once you filled your buck tag, you wanted to get another doe, you get another tag, and then it evolved to the point where you could get up to 6 doe tags a day, unlimited. And hunters used them.
A day?
6, you could get the tags. I could give you, here's 6 tags for you today. Come back tomorrow and say, I want more 6 tags. Here you go, without even filling them.
Oh, okay. How did you keep track of the earn a buck? I mean, was it just on the honor system? A hunter would come in and say, yeah, I shot a doe, can I get a buck tag? Or?
No, they have to bring the doe in, and then they got validated for the doe, and they got a sticker authorization that then they had to put on the tag that once they brought a buck in, you make sure that it was valid, that they're using it with a valid tag.
Oh, okay.
Brought it into an agency office?
Deer registration stations, yes. So in Wisconsin, at this time, and up until just recently, in-person registration is a requirement.
Tami,
It's changed in the last 2 years, but.
Sorry.
No, go ahead.
Did they still have to pay for these extra tags?
No, these tags are free.
Okay.
So hunters were required to shoot a doe before they could even shoot one?
That's correct.
And are those regulations still in existence now?
No.
No.
So, yeah, so there's an evolution. So we had this Earn-a-Buck opportunity for quite some time, and then that slowly went away, kind of transitioned from Earn-a-Buck to what was called bonus buck. So you could basically get additional, you could still shoot your buck first, but then if you wanted to get additional bucks, you could. To now, there's no bonus buck either. Let's see, so we transitioned also, 2006, I guess, is, that's kind of the year, so after 4 years of October gun hunting and Earn-a-Buck, and we have an annual public process, and we're very responsive to public input. So in 2006, things started to change. You can see that the October gun season was not in the rut any longer. It was moved up to earlier in October. We didn't have Earn-a-Buck. We were able to retain Earn-a-Buck thereafter, though, for a few more years, but nonetheless, that really effective late October gun hunt got moved up to earlier in the month.
And so how is that affecting the population of deer, the density of deer?
So we did have a period of time where we were starting to affect that population across the South through all these tools, through hunter harvest and expanded seasons and extra tags and agency shooting, etc. We were able to have an effect on the population. I have a graphic that will show that, but we did have a downward trend there for several years.
And I don't know if you will mention the landowner permits that were given as well, just to give people a flavor of how wide open things were.
Yep, that's coming up.
Okay.
So we also had baiting and feeding restrictions, as I mentioned before, but what transitioned from, we had that originally, we had a statewide emergency rule. But then in 2004 is when we got that state statute that I described to you yesterday with a 10-mile radius. I'll just state it again. It's basically statutory authority. We're basically required to implement a baiting and feeding ban when CWD or TB is detected in the wild or in captivity in any county that, where that detection occurs, so that county gets pulled in, and then any county that falls within the 10-mile radius of that finding, the entire county gets pulled in. So you've had that in effect now since 2004. A little bit more on the agency culling. Our goal was to remove infected deer and reduce the populations in those eradication areas, as well as any sparks as the disease was starting to spread out from those core zones. So we focused in on the sparks as well. It was an effective tool in meeting that goal. And I just have the 2006 numbers here just to exemplify that fact. So we did remove more antlerless deer than hunters did. And we were more effective at removing CWD positive animals than hunters were. And overall, what we removed was only 1 to 2% of the harvest. But nonetheless, agency sharpshooting was not something that was really, over time, patients were thin, I guess. They were supportive at first. A lot of what their concerns were are kind of disputed here with these kinds of statistics, but nonetheless, the perceptions were what they were, and eventually our sharpshooting program ended. This is actually just the year before, the winter of 2006/7 was our last year that we did any sharpshooting in Wisconsin.
That was DNR staff?
Correct. Well, DNR staff, but we also had USC Wildlife Services was able to help us out in the beginning. They weren't able to participate for that full duration across all those years, but in the initial response, they were very, very effective and helpful. So we also had various incentives out there to try to help reduce the deer population. We did have an incentive or reward program, what we called Focus on the Positives, in cooperation and with funding from Whitetails Unlimited. We were able to offer a $400 reward on CWD positives, and that reward was split between the hunter and the landowner, so 50-50 split. And we also had a $20 reward lottery for every deer that was harvested. And so you got entered into a lottery, and if you got drawn, so the more deer that you harvested, the more lottery tickets you put into the hopper, and then the more chance that you got at receiving a $20 gift certificate to Gander Mountain. So additional incentives that we had a venison program. So we wanted hunters to harvest a lot of deer. That was a message. They heard it loud and clear. But what we heard back was, well, we only need 1 deer, or I only have so much room in my freezer. So we established a food pantry program that's in effect today. One of the things that we did is that we actually paid the processors in the area to process the hunter-donated meat. We also offered free landowner permits that basically a landowner could hunt deer on their property without a license, as long as they met all the licensing requirements. They could also shoot deer from equipment, farming equipment. And so that was a pretty popular thing. And they also had, we also had a landowner season that went until the end of March. And so they had basically the opportunity for either sex harvest.
Tami, in terms of your donation program, I had a situation at one point, it was with pheasants actually, but here, in order to donate to a food bank, whatever the case might be, that meat has to be processed at a inspected and licensed facility, same in Wisconsin?
Well, all the meat processors that we worked with the food pantry program are meeting all the requirements that need to be met.
So Tami, on the landowner permits, was there a limit to the number of permits a landowner could get, or was it as many as they wanted?
No, there's no limit.
And then, was it for the landowner themselves to use, or could they give those away?
So it was originally it was for the landowner, and then it evolved to, so one of the things that happened here was that the landowner permits were free, and then over time that kind of sent a message that somehow deer were a less valued resource than what they truly are. And so then that evolved to a minimal fee, so it was a $2 fee for the landowner permits and a $2 fee for a hunter permit. So hunters could hunt on landowner permits for $2. If they hunted elsewhere, if it was another parcel that wasn't in the landowner permit program, then they had to pay the full, a license fee. But it was again an incentive, to focus in on the area where we wanted deer to be reduced.
Go ahead, Chair. What percentage roughly of Wisconsin is private land? That was the same question.
Yeah, I mean, I don't know what the percentage is, but I do know that the percentage of private land ownership is greater than public land ownership, but that's as far as I can take it.
I think it's close to 90% in this area. It's
Okay.
very high, yeah.
Did you have any opposition from the sporting community to the advantage that the landowners were getting in getting, you know, free access and more access to hunting than, you know, hunters that weren't landowners? Or was that not an issue?
There's a
for you
little
guys?
bit, I mean, we heard some of that sentiment, but I wouldn't say it was strong. Wasn't a strong message that we heard.
You had
I
that
think
note-
in general, there's more of a, there's an opportunity for those hunters. If they knew a landowner, they could take advantage of that system.
You have the no trespassing, no hunting sign up there. Was that implying that your government hunters were able to hunt on the farms that didn't allow any public hunting?
Yeah, I'm glad you asked that question. So our approach to our sharpshooting was to request permission from landowners for access to their property to do sharpshooting. And then so in many cases, there were areas that either didn't allow hunting or, you know, so we were trying to get into refuges as much as we could, areas that weren't hunted. So that was definitely, you know, part of the process.
So I take it there was some success, but not universal.
Not every land, I mean, so some landowners, you know, you can think of every iteration, I guess, you know, landowners that let us on in the beginning, and then over time they didn't want us on there anymore because they weren't seeing any deer. We also, to try to kind of sweeten the pot, if you will, they were allowed to it evolved to, when we had our sharpshooting, we did use bait for our sharpshooting. It was kind of a weighing the pros and cons in a disease zone, but you know, we removed the bait when we were done, and we removed all the animals that came into the bait. It wasn't just a one and done type approach. But nonetheless, the landowners could hunt over our bait, and as part of the state that had no baiting and feeding for hunting for the general public, but for our sharpshooting endeavors, you know, we did use it, and the landowners that allowed us on their lands could also shoot over that bait.
The landowner hunter permits, can they charge like a trespass fee or for the hunters that are coming on, or do you have something like that in Wisconsin? A fee to hunt, like basically, you know, to go on someone's property in Montana, they can charge the hunter to come on like a trespass, basically pay fee for hunting.
So that to me, I guess what we do have in Wisconsin are private lands that are leased out to others, so there's like leasing payments. So that to me is like, I don't know about anybody paying because it says no trespassing. It's more of a private landowner who establishes a leasing agreement with a group of hunters, and the hunters pay that landowner to hunt there.
So, sorry, but I think, so could they take advantage of all those tags to make more money from?
No,
from
they
that
can,
side?
that's definitely, so it's similar, in this case, or even in other cases like agricultural damage permits where we issue permits to landowners. You can have other people come and help you with, you know, but you cannot charge a fee for it. And in fact, if they were to charge a fee, you know, the message would be call 1-800-TIP-WDNR so our words can follow up. So it's not something that would be legal.
So is that in statute? Is that rule?
I don't know.
Okay. Huh.
I would assume so because our wardens enforce
Right.
statute.
Yeah.
Statute and rules, so. Okay.
Yeah, if they're unlimited EAB, what's EAB?
That was earn a buck.
Okay.
So that was the, harvest a doe before you can harvest a buck. Which is really that tool was very effective because, you know, deer hunting is very much, for a lot of hunters anyway, very much about the trophy, very much about the antlers. And so once they get that nice buck, they're done hunting. So we knew at least with earn a buck, we'd get those hunters to harvest at least 2 animals instead of 1. And then with having it be unlimited, you know, obviously they could harvest many more. So that was the first basically 5 years of our agency response. 2006 was a landmark year in that you know, we consider that to be a time frame in which we completed our initial assessment surveillance phase, and we were ready to embark upon our next phase of CWD management. And so we had a group of staff that were very much involved with CWD over the years. We had a retreat, and during that time we kind of reflected back on the year and our goal of eradication, and kind of made an assessment of where are we at and have we been successful. And our conclusion was that we had not made as much progress as we had hoped to at that time, and we didn't, you know, as a kind of a sobering conclusion, we didn't achieve the herd reduction that we had. I guess we hadn't made sufficient progress to achieve the herd reduction that we had hoped to, and so that was basically the advice that we gave to our secretary of our agency at the time, and so we embarked upon our next phase of planning. Before I move on to that, though, I will say, because I know this is asked, during that time frame, that's all 5 years, we spent $26.8 million on all this work, which is about 1/2 of 1% of the $5 billion industry over the 5-year period, as Mike alluded to yesterday. So it's pretty much a small drop in the bucket for the big economic impact and cultural importance that deer hunting is in the state of Wisconsin.
But that 26.8 million was DNR money?
It was primarily that federal funding that,
okay.
there was some DNR money, but it was mostly federally funded.
Okay.
Did that money come out of taxes to the hunters that, you know, 10% tax on shells or guns or?
No, it was mostly the federal funding that I referenced earlier, and then our state funding is more segregated account funding from licensed dollars. So this is, sorry, I didn't say anything about this map. So this is essentially what the landscape then looked at this time. As you can see, every dot on that map is where a CWD positive animal had been detected, and also shows a good depiction clearly of how it kind of correlates to what was happening across the border in Illinois. So that brings us into the second phase of CWD management in Wisconsin. And so after our retreat, and after we realized that eradication wasn't a goal that we could achieve, what we recommended and advised to the secretary at the time was that we seek to contain the disease and to prevent spread. So containment became the primary goal, is contain it where it is. And if we're successful in containing it, then we can seek to control. And if we can control it, then we can still seek to for eventual disease eradication. One thing that I would share with you here is that, in the beginning we were seeking to eradicate the disease, yet what the public heard was eradicate deer. So that definitely is something that, to this day, I would say some people still think that's what we want to do, and it's not. It's always been about eradicating the disease to protect the herd. But just wanted to share that. So based on the new management goals that we identified, containment.
You may have said it already, but initially you thought that the prevalence was 2.9%. After you had done more testing and whatnot, what did the prevalence end up being?
I can give you the prevalence that we know today. I don't have the prevalence at the time of 2007 at my fingertips, but
if you're getting
what's coming up, okay.
Thank you.
Okay. So we really recognize one thing I didn't say. So we really recognize, there's a lot of things I didn't say. This comes to be honest. There is so much to share. So in 2007, we decided as we move forward in our next phase, we're going to involve the public, and we're going to involve them just like you're doing here today. But the other thing that I would, just looking back, one thing that we did do, even though we kind of said, all right, we're going to do an aggressive response, these are the things we're going to do, and we started doing them. We informed the public along the way, but most of our outreach outside of like the media type venues was through door-to-door interactions. We, as we were seeking to get permission for sharpshooting, issuing, we did this huge outreach effort where we knocked on doors. We had staff that were designated as landowner liaisons. We assigned them townships. Those staff that had the townships, you had like the primary township liaison and then their crew. And their whole focus was door-to-door interaction. And the key message that they were told was that eventually, the first point of business should be CWD is in the neighborhood. I'm here to share with you information about CWD and answer any questions that you may have. That was the first step. Then as they kind of developed those landowner relationships and talking about CWD and deer over coffee, eventually those conversations would lead to, what do you think about allowing access for reducing deer on your property? So it wasn't the first words out of our mouth when we had those landowner was, can we shoot deer? But I did, so I think that's an important part for you to know and be aware of. So we have always had an appreciation for the hunting public and for our public in general and getting their input. The state of Wisconsin is very much about public process. We have annual meetings, and for every deer management unit of the state, we get hunter input about population goals and objectives and harvest quotas, and we're always adapting and changing based on that public input. So, as exemplified by the next phase, where we embarked upon our first citizen stakeholder advisory group process. And so we wanted this group to help us identify what our CWD management goal really should be. And so from July of 2007 through January of 2008, we had a stakeholder advisory group process, just like you are embarking upon here in Montana. And we had 18 citizens with diverse interests that offered recommendations on CWD management. And this is kind of a reflection of the spectrum of the results of that process. And so you have a range of do nothing to eradicate, and the majority of the group fell right in the middle of seeking to slow the spread and contain the disease in Wisconsin. So that then, there's a lot more to the process that, and I have a copy of the report if anybody wants to see it with me, but so ultimately a lot of goals and objectives were identified relative to slowing the spread and containing it. And that led us then, that stakeholder advisory group process then led us to our current CWD response plan, which I brought a copy of as well. And it is a 15-year plan. And so the first, this part of the presentation, I'm going to just provide you with an overview of this current plan. And one thing that's kind of interesting in how this went forward, though, is that after the Citizen Advisory Group finished the recommendations and the plan was drafted, that was in 2009. That was presented to our Natural Resources Board, and they determined that the plan didn't go far enough. It's kind of hard to see, but on the left-hand side, the draft was chronic wasting disease, a plan for managing chronic wasting disease in Wisconsin. And basically the Natural Resources Board didn't believe that the plan went far enough to managing the disease, and they basically commissioned an expert scientific panel of 6 members to review the plan. And so the plan was analyzed and then revised as a result of that external panel review process. And one of the key changes that was done was just the title of the plan, acknowledging that the plan itself isn't necessarily a disease management plan, it's more of a disease response plan. And also, that's when they identified that disease management and a disease like chronic wasting disease is something that's going to take a long time, a long-term commitment to achieve. And so the plan should reflect that. So a 15-year plan time frame was identified. In addition to that, the fact that the plan needed to be reviewed every 5 years.
How was your expert panel chosen?
Yeah,
right.
So at the time, our Natural Resources Board was chaired by Dr. David Clausen, who was in that no accident film that we saw yesterday. He's a veterinarian, very much interested hunter and interested in deer herd health and wildlife health in general. And it was through his leadership and insights that he embarked upon that external panel review. How they were identified was based on knowledge of who across the nation had expertise and experience with wildlife disease and CWD and response to wildlife disease.
Well, the reason I ask is because I could see if you got some, because there are some quote-unquote experts out there that are kind of doubters as to the effects of CWD and whatnot. And if it was weighted that way, you could end up with a response plan that really wouldn't be a response plan.
Right. So, so anyway, yeah, I don't have the right panel, that's an earlier panel, but nonetheless, that's how they were selected.
Okay, great.
Okay, so this is now our current plan, with the goal of minimize the area of Wisconsin where CWD occurs and the number of infected deer in the state. So that's the new goal. This plan is broken down into 6 objectives with 24 action items to meet that goal. So these are the 6 objectives that we're currently operating under or seeking to achieve. And I'm just going to go through each one of them real quick and identify for you some of the action items. So the first objective is to prevent new introductions. Clearly, prevention is cheaper and easier than fighting an established disease. So fingers crossed for Montana that you're able to, that you're successful. There are 5 action items that correlate to this objective and all focused on baiting and feeding bans, carcass movement restrictions, working with our Department of Agriculture on the captive cervid industry. So that reference to the captive cervid industry then brings me to that interesting side story that Emily kind of asked about earlier. So around this time that we started this new phase of our CWD response, we had a deer farm in Wisconsin that had known CWD positive animals, and it took many years before they depopulated the farm. And when the depopulation occurred, there was an 80% prevalence rate from that depopulation. And this farm was located in an area of the state, central Wisconsin, where CWD was not known to exist in the wild. And so we were very concerned about this situation because at that time there was a requirement. So this farm, when a CWD positive farm was detected, they were issued a premise plan. And that premise plan basically, after depopulation, kind of delineated what actions that they needed to take place, as well as precluded them from repopulating the facility with any cervid for a period of 5 years. After that 5 years, so they basically had to scrape the soil, clean all the equipment and structures within, scrape the soil, bury the soil, and then not have any cervids for 5 years. But after that period, they could either put more cervids in there, or they could do something else, or take the fence down. And we knew that this farmer was not planning to continue to do farming, and that in fact the property, well, first of all, we knew that the farmer, that the fence could come down, and we were concerned about that. So our Natural Resources Board actually developed a resolution, and the resolution was targeted or aimed at USDA, and this resolution was presented at the U.S. Animal Health Association meeting, where it was asked for support in this resolution, which basically was a plea to USDA to please, work with us and work with this farmer to prevent those fences from coming down to protect that wild deer population. And that ultimately, we weren't successful in that endeavor. So what we ended up doing was we literally bought the farm. And so we knew that that's what we had to do. I mean, that kind of level of prevalence in an area of the state where CWD wasn't known to exist, we really were very strongly compelled to do something to prevent that local deer population from getting exposed to that contaminated environment. So we purchased the farm, and then shortly thereafter that, we cleaned up all the vegetation around the perimeter of it and installed a secondary fence. And that fence remains in good condition today. We're still proud owners. And we actually have the house on site. We have staff living there, and it's kind of been a rotating door over the years, but one of the tenant requirements of living there is that they have to monitor the fence once a week, and more frequently if there's any kind of big storm event, just to make sure that the integrity of the fence is maintained.
Is there any research going on there for introduce some deer to see if they do get CWD?
Yeah, well, so that was certainly one of the justifications for purchasing the farm, was that this is a property that could provide really good opportunity for research. We've not done any there, however. I mean, there just isn't a lot of funding for research, and then something like what you identified, if we were to bring deer to the facility, one of the things that we did was that we had a local public meeting when we bought the farm, basically identified why and what have you. But the other thing that we did is that we assured the community that if any research should occur there, that we would talk with them about it and let them know about it. Because one thing that they would be concerned about is us bringing any, they're concerned about even if we brought deer in that were healthy, if they came down with CWD, they're just not comfortable with having any CWD positive animals in that facility or in that area. So I think more of the research there, opportunities there are more about things like composting or prion persistence in soil.
Right.
This would be a great opportunity to find out, right now, scientific literature, 2 to 3, there's, depending upon carcass or environment, we know that CWD prions persist in the environment for at least 2 to 3 years. But we also know that scrapie prion can persist for 16. So that was a reason why, we don't know if CWD can persist longer than 3 years, and this sure would be a good opportunity to find out. But long answer to no research yet, but
Okay.
facilities there.
How big of a chunk of ground is it?
I think it's 80 acres. Oh.
Did you have any kind of animals in there at all?
No. I mean, other than free-flying birds and maybe some mammals that might be crawling through the fencing, I guess. We did have, there was interest in using the facility for the vaccine research that's been undertaken in Canada. They had some interest in using the facility, but that ultimately didn't go anywhere because there's an awful lot of requirements to be met to have that become like a research type facility for that purpose. But anyway. Okay, so that was my sidetrack on our deer farm. So then the second objective in our current plan is to monitor and respond to new areas of disease. So our goal there is to quickly detect new disease outbreaks and respond to them. And so we're essentially, when we do detect new disease, we intensively sample around that area. And we'll discuss that a little bit more in detail. But that's essentially the second objective. The third one is to control the distribution and intensity. So, you know, we want to reduce the number of CWD positives on the landscape as well as reduce the number of susceptible animals that are out there. All the action items within this objective are all about basically you know, reducing the deer herd and providing increased hunter opportunity, as well as there is a stated action item to continue sharpshooting. But as I have already previously stated, that's not something that we've been able to continue.
Tami, do those actions occur like you described early on, where it's focused on the known locations and kind of?
Yeah, I have a map that'll show that 2016 to kind of help delineate the approach a little bit further on here. Okay, so we had the fourth objective is all about outreach and education. The action items here identified using an external communications firm to help us. One thing that we identified through our processes is that we're not marketing communication experts necessarily, and we really don't do as good a job as we'd like to, and so hiring somebody to do that for us is kind of a key action item that was identified. And so we did hire a communications firm, Staples Marketing, and we did all sorts of things from TV commercial ads, billboards on the roadside, to you know, a dedicated website, knowcwd.com. We came out here and did some, have a video on here from experiences out west. All sorts of pretty neat things. And then after, we did that for the duration of from like August through November of 2011 year season, and then the winter following that we did focus groups. And we learned through that process that you know, this marketing outreach education was effective in kind of dispelling a lot of the myths that were out there. At the time, there still was this belief that we were trying to eradicate the deer, and in fact, we did all sorts of outreach to try to get people off of that, and this measured that, and they said, you know, we were basically starting to move that needle, which is a good thing. But unfortunately, we weren't able to continue working with this campaign or this marketing approach due to funding shortfalls. So, but we did have 1 year.
Did you see an increase in reports from the public of clinical symptoms in the field in deer?
We do. We have, and we do to this day. Okay. So what we do have I guess intended focus on sick deer response. We do outreach on that on an annual basis. We have sick deer response policy. We have a dedicated page on our website about what you should do if you see a sick deer. You know, for us, that's like we want to remove any diseased animals from the landscape to prevent spread. And we also, you know, want to be aware of any new outbreaks that may be out there, and sick deer detection is, you know, one of the best ways to find new locations.
Do you have an idea how much that cost to hire that firm? And
I do, and I could get that information to you. It was a couple $100,000. Yeah. And then addressing the needs of our customers is an important objective, and you know, we do that through not only through the outreach and education, but also offering opportunities for them to get their deer tested. Offering the food pantry program option that I mentioned earlier, and that working with our Department of Health on monitoring any risks that there may be to human health. Working with our Department of Agriculture on any risks to livestock or captive cervix, as well as waste management. And, you know, hunters' ability to, customers, I should say, ability to dispose of waste is an important action item with this objective, and it's one that continually poses challenges for us and for our customers, whether they're meat processors or hunters. Unfortunately, I'd say in some respects, CWD is, carcasses are viewed as toxic waste. In some cases, it's really hard for, well, landfills have varying opinions about this. We worked with the university on, one of the key things is that the landfills and their wastewater, municipal wastewater agreements, it's the waste, the landfills tend to be okay with accepting the waste. It's more the fact that you can't say that there's zero chance of the prion getting in that wastewater. And so there's actually a state statute that was created for landfill indemnification so that we could find landfills to accept the waste. And if anything should transpire down the road wherein it's causes CWD somewhere where sludge is spread or what have you, they would be indemnified or would be, you know, held liable for putting CWD on the landscape. So we were able to get some landfills to sign on to that, but there's still challenges. In some cases, you have to go very, very far with that to transport that waste. To get it to the landfill that will accept it, which increases your cost for disposal. You have haulers that, even though the landfills that they're hauling to may accept the waste, the hauler's perception is, well, we can't take that waste, and so then they tell the meat processor, you know, we can't take your waste, and the meat processor is like, what are we supposed to do with our waste? So it's a continual challenge. With our, you know, our agency actually administers our statewide car-killed deer contract, and it's gone through some recent changes because of these challenges. It actually says in the contract that they can leave the carcasses lay, just drag them off the roadside and into the shoulder, instead of collecting them and transporting them. I mean, the assumption there is that those animals are likely from the local area, and so the risk for disease spread is low. But obviously it's not zero and it's not perfect, but at the same time you know, they're running out of places to go. And we continue to try to, and we work with our, the wildlife program and solid waste program, continually work together, and there's some outreach that we're planning on doing this year in advance of the coming season to try to get at some of these perceptions, because, you know, we still maintain that landfilling is the best way to dispose of deer waste.
So did you guys prohibit carcass dumping? You know, a lot of guys process their own meat, and some guys just throw them away, but I noticed a lot of guys just take them off and dump them into the road someplace.
Yeah, it's not legal. It's wanton waste, and it's not proper disposal.
So you have a statute or a rule, or?
I think it's both. There's a statutory requirement, and the rules that were developed are enforcing that statute. And so basically, you know, like whether you're somebody who processes deer, or if you're a farmer, and if you leave a big pile of carcass waste on the landscape, it's just not proper disposal.
There are some statutes in Montana too that are DOL, Department of Livestock statutes.
Is it for deer and elk carcasses?
It would include deer and elk carcasses.
Tami, in Wisconsin, is it more customary for hunters, when they harvest deer, to bring them whole to a processing plant, or will they eviscerate them in the field? I can't imagine it, elk, if we got it in elk in Montana, anybody putting a elk that hasn't been.
Yeah,
just back of a pickup.
the common practice is field dress.
Right,
Okay, So some new initiatives that we've incorporated over the recent past is working with taxidermists on weighted surveillance sampling, which Mike talked about yesterday. So I won't really go into that other than it is a new strategy that we have. It's a strategy for not only detecting new for disease detection surveillance. But it's also a way to incorporate and work with our customers, or the taxidermists who work with all of our hunters. We also have in the far northwestern part of the state a citizen advisory team that was formed in response to the one CWD positive that was identified and is still the only positive that's been identified to this date. And Mike did a good job covering that as well yesterday. But again, the incorporating citizens in our response planning is an important adapt and management strategy that we incorporated in response to our experiences with the first 5 years.
Tami, in that regard, so the plan you just covered, those 5 objectives, when the board, or 6, whatever, I'm sorry, when the board bounced it back and said it didn't go far enough, did the board then put substance behind that, and the board identified those additional or new objectives, or it bounced back to that citizen panel that we had? What was the back and forth there?
It was basically revised as a result of the panel and implemented.
So the panel was the source of the...
The panel was the source of the change, and then the department responded to that change. So there wasn't a lot of back and forth with our Natural Resources Board or with the Citizen Advisory Group that informed the plan. Another new initiative that kind of helps to meet the needs of our customers is, the desire for knowledge on what to do with your carcass waste, how best to process your animal, what can you do to prevent the spread. So we developed a document, recommendations for reducing the spread of CWD, which is available on our website. And so that's information that we heard loud and clear that was of interest, and it's all voluntary actions, but nonetheless, there are actions that, if taken, can help reduce the spread. We had recently just revised it. I should say we most recently just revised it with the addition of information on urine-based scents that kind of correlates with some of the conversation yesterday and awareness of what the industry is doing, and the Archery Trade Association's initiative on urine-based scents. Yes?
And do we have the URL for your website somewhere?
And my very last slide.
I'll watch for that.
And then the last objective of our plan is to enhance the scientific information, and so we work. Over the years we've done some quite a bit of collaborative research in the world of CWD. We also have a pretty significant tissue archive and a process for making those tissues available for research purposes. We have a process that we have in place where a research proposal, bona fide research is being done, for the use of that tissue, and we have a process wherein a collaborative committee, department and external partners would review and determine whether or not it's research that would be, worth pursuing. It's been quite some time, however, since we've actually provided tissue for that purpose, but we still maintain the tissue bank. It's just something that we can't bring ourselves around to getting rid of. Okay, so that's kind of like our experience with our CWD response plan, and so we're only, a couple of years into implementation of the first 5 years of our 15-year plan. And then along comes Dr. Deere. I'm sure a lot of you are familiar with this process, or this, you've probably heard that our governor, he basically commissioned a 3-member panel to look at deer management in Wisconsin. So it wasn't just about CWD, it was just deer management in general. You know, we have a very passionate public interested in the deer herd in Wisconsin and how it's managed. And Governor Walker was very much aware of that, and that was something that when he ran his campaign on was, you know, he had a very strong sportsman message. And so shortly after he became governor, his first term, he hired this 3-member panel, and Dr. James Kroll was on this panel. And so there's a very extensive public process that was implemented to inform the implementation of his report. So basically, you know, they received all of our data and records and information, and they poured through it, and in the end came up with 60-some specific recommendations, of which 14 of them were specifically directed towards CWD. There was the implementation of the Deer Trustee Report Plan was a 5-month process. We had citizen teams that were broken out into subject matter. The citizen team that I served as a liaison to was the herd CWD and herd health team. So they then took those 14 CWD recommendations and made recommendations on how to implement them. So in addition to, and so one of the key things that that certainly was heard loud and clear and resonated pretty widely beyond our borders was the one recommendation about being more passive in our management on CWD. That was one of the recommendations that came forward. So what does that mean? How do we respond to that? How do we implement that was a big point of our deliberations and conversations in that citizen process. In addition, big changes were made to the landscape of CWD, or of deer management in general. For years, we had a process of management through deer management units that transitioned to county-based management. And also our season structure changed, and so earn a buck, as I mentioned, transitioned to bonus buck, but then it was removed completely in 2014. So since 2014, we've not had earn a buck as a tool. Also, the CWD management zone in the southern part of the state, again, which shows those 2 primary areas of infection, kind of lost its meaning over time, and the reason being is that in that area on the left, we had all those expansive seasons and additional opportunities, whereas on the other side of that border, there was still traditional framework occurring, and that kind of over time, you know, the patience for a reduced deer herd, patience for additional opportunities that not everybody could participate in, the fact that there's over time, the sentiments grew of the just weariness of all this extra effort, and can't we just go back to normal, and we just want to have our regular seasons back, and it's really confusing to have things different on different sides of the border. So ultimately, the season frameworks became the same. So, and because we didn't have any of these tools any longer for disease response, it just kind of, the zone itself kind of lost meaning. And so, and that was something that came from the Deer Trustee Report implementation process too. So ultimately we eliminated the CWD management zone reference, and instead now we just essentially refer to the southern, that portion of the state as our endemic zone. The disease is very well established there, and so that transitioned then to the terminology and use of CWD affected counties, which is the map on the right. And so essentially CWD affected county overlaps with the baiting and feeding ban, so it represents counties that have CWD either in the wild or behind a fence or an adjacent county. And this, oh, and then also Governor Walker, during the implementation process, he did identify a source of funding for CWD. So, you know, I mentioned earlier that our federal funding kind of dried up, and so then it kind of transitioned over to state funding, and the state funding kind of was a consistent funding level. And so he established a $2 antlerless fee for CWD on the sale of antlerless tags. So to this day, that's the level, that's our primary source of funding for our CWD management. CWD response turnaround time was also a point of interest in the Deer Trustee report. And essentially, one of the recommendations that he made was that we should seek to do better and turn around faster. This slide here basically shows, you know, kind of the evolution of our timing, and which is in part due to changes in our practices, operational field protocols, reduction in the number of samples, but also efficiencies that we've gained. So every year, CWD testing turnaround time is a point of discussion for us, and we're always trying to do what we can to shave off more time.
Does the $2 on the antlerless licenses cover the expenses for the effort?
Well, it did last year because we had a very low number of samples because that was the first year of electronic registration. But up until that, we still needed to augment the funding with other funding sources.
Can you pop out gross figures for state deer population and deer harvest, those two?
Statewide deer population hovers around 1 million, 1.2 million, 1.4. So I would just say, you know, on average, it hovers around the 1 million. As far as harvest goes, that too, but I'd say 400,000 average.
Is that public or all? Means that domestic or and wild, or is that?
No, that's specifically wild. Yeah. Okay. So we just completed our 2016 surveillance year as of March 31st. So basically our surveillance season runs from April 1st through March 31st of the following year. And as I already just mentioned, there's this is our map. There are 43 counties, I don't think I said that, but 43 out of 72 of our counties are designated as CWD affected. And this just kind of shows a little bit further how or why they are designated as such. The dark blue counties are all the counties where we've had detections in the wild, CWD detections in the wild. All the dark green counties are counties that are affiliated with CWD positives behind a fence. And all the light blue counties are what we refer to as buffer counties. Basically, there are no detections there, but they got pulled in because they fell within that 10-mile radius that I described earlier. And then the light green county is one deer farm that was positive, that we know of 2 positives that escaped and were on the landscape for at least 6 months, and both of which one was removed by the farmer and another was removed by a hunter. So that's kind of got its own unique designation, and is, you know, identifies why we're interested in why we'd be doing surveillance in that part of the state. So then getting to our specific strategy and how it is that we conduct our surveillance. So essentially what we seek to do every year, so we have a group of internal staff that we refer to as the CWD team leaders, which are program staff from all the areas of the state that are dealing with CWD and responding to a finding there and implementing field operations protocols to get samples. We have always are trying to get samples every year from our two primary areas of known, our two initial outbreaks. Long-standing database is important, to inform what we know about CWD in the state. Then, this is like where that old CWD management zone was, and in our minds, we still kind of think of it, even though it went away officially, we still think of it, about it, and consider it in our processes, because we like to ring the perimeter up for any potential new introductions that may be coming from the endemic zone. So we, and then we look at also like what's our sampling, how's our sampling been in these counties, do we need more samples, that informs our decision making too. So then we identify specific counties of interest where we want to get samples out of these brown areas. Then we also, as we're ringing the management zone, one of the things we do is weighted surveillance, and that too rotates around that perimeter. This past year it was in these two counties. That's where we really put that concerted effort towards working with taxidermists and working towards that formulation approach of weighted surveillance that Mike described so well yesterday. Then all these circles on the map are where we have CWD positives. Either this is that one I mentioned earlier, and Mike mentioned it too, where we've had one lone positive here and really good surveillance so far, but we're still, what we did this year, which is new than previous, is that we expanded to the 4-county area in our surveillance approach. But our consistent approach is to have a 10-mile radius surveillance around a known positive, and just do the best that we can to get samples within, well distributed across that zone to further assess distribution and prevalence of disease.
So Tami, how long so you get in a deer farm, there's a positive, and then how long is that a focus area for surveillance? Is that indefinitely or?
Pretty much. We still do surveillance up around the farm that we bought, and that was populated back in 2010. We even did surveillance around it where there were still deer there because we knew it was a positive farm. So we kind of just make that decision on an annual basis, but we still think that that's an area that's important to surveil. And in fact, it's a good thing that we have been doing that, because we have since had 2 positives detected that were within literally feet of the fence. We also, one thing that we do and we've always had in place is a long-standing policy and practice of offering hunter service testing. And what that means is, even though we've identified these areas of particular interest for us, if anybody harvests a deer outside of any of that primary area interest and they want to have their deer sampled, we won't say no. If they want to take their deer to one of our cooperating locations, they can do that. They can contact the local biologist and make arrangements. So we don't turn anybody away. The other thing that we have established is a network of veterinarians. There is information that we do every year, and we've worked with training veterinary clinics on extraction of lymph nodes. And so if a hunter is in a part of the state where they don't want to drive or there's no cooperative location, they certainly could go to a cooperating veterinarian, but they end up paying quite a fee to do that. Our processing, the hunters don't pay for CWD sampling. We pay for that with programmatic dollars.
What's a cooperating station in Wisconsin?
Yeah, I was just thinking that. I didn't really cover that, but I kind of will here a little bit. So cooperating locations can be gas stations, bait and tackle shops, bars. Those tend to be like the primary type. Had a few like liquor stores, whatever, just. And so in the earlier years, they would just agree to, they and their employees would get trained and we provided protocols. Hunters go there and they either assisted the hunters with removing the heads, and over time we actually got to training our cooperators, and we have training sessions that we hold at our CWD processing center, and so we train cooperators to extract lymph nodes. Taxidermists are another one, meat processors are another, just whole conglomeration of cooperators. And when they get payments, they sign into an agreement with us, and then they get paid per sample. And then they'll accommodate some type of sampling approach. Freezer to put the samples in, or in this case, this is an example of a self-service kiosk. It's something new that we've embarked upon in the last 2 years. We did a pilot 2 years ago, and then really grew that this past season in 2016 as a way to be responsive to electronic registration. So I mentioned earlier that we had a long-standing requirement for hunters to register their deer in person, and then we got electronic registration that went into effect in 2015. And when that happened, it was hard for us to get our hands on the samples. And we had a pretty significant drop in sampling. This past season, 2016, we implemented all sorts of new initiatives to try to bring that sample volume up. So these self-service kiosks, they basically, they know where these kiosks are. They tend to be affiliated with our office buildings so that we have staff on site that can check them on a daily basis and collect deer heads, basically. This is, but sometimes hunters drop off lymph nodes, or we had some weird things dropped off. But in the end, we had 30 of them last year, and they're very popular with our hunters. They don't want to necessarily, it might actually short stop their drive from maybe where they hunt to where an established cooperator location is. There might be something in between like this that they can use. We're kind of weighing the pros and cons of this approach. It's great for the hunters, they like it, but now we're kind of getting away from those cost efficiencies that we established over time. So, but we'll strike a balance, and I see this as continuing to be a tool that we use.
Were the cooperating stations also where the present a doe or earn a buck opportunity happens?
Yes. Hmm?
Keep mentioning lymph nodes. Are you not collecting the OVEX as well?
We're not. So in the early years of our CWD sampling, we were able to help, I guess, inform ultimately the gold standard for lymph nodes, because in the early years we did both. We did lymph nodes and OVEX. And we also established a processing center that is in place today where we can process all these samples. But yeah, we don't do OVEX anymore. The gold standard is lymph nodes. Also in response to electronic registration, and do you have electronic registration in Montana? In-person registration? Okay. So one of the other things that we did to try to bolster our samples last year was we had different messages that you would get when you did your electronic registration, depending upon where you were located in the state. So those counties that are in the dark gray shade received what we refer to as a more persuasive message. We really try to compel hunters to make the extra effort to bring their samples in. And then the other lighter gray shaded counties got more of a voluntary message. So this was, again, a strategy that kind of overlays with our surveillance approach and trying to get those samples in the new environment of electronic registration. I already talked about sick deer response. So I don't think I need to go there or describe that anymore. And then this is the most recent statistics on our testing. So we've analyzed in 2016, we analyzed over 6,000 samples, and that was like nearly double what we had the year before. So our enhanced efforts this past season worked really well for us. Overall, we've analyzed almost 200,000 samples since the beginning of CWD detection, and we've identified over 3,500 CWD positive animals to date. And then, again, you see the testing turnaround time, and I realize when I see this now that yesterday I misspoke. but our testing turnaround time for the 2016 season was 9.6 days. I think I said 12.6, but 9.6 is correct.
What about prevalence over time, specifically in the southern farmland?
How did I miss that? Oh, I think that's coming up.
Okay.
Almost done. So that's one of the key challenges that we have on our landscape is what's happening with prevalence. So first of all, you know, we're continuing to see an increasing trends in both increasing prevalence and spread of the disease. During the past 15 years, we've had the adult male prevalence has risen from around an 8 to 10% to 30%. Adult females have gone from 3 to 15%. Yearling males 2 to 10, and yearling females 2 to 9. So that's definitely obviously a key challenge that we're facing. And this graphic here is the area of Iowa County that we refer to as Wyoming Valley. And you know, as you can see here, we're getting prevalence that's approaching the 50%, and it's approaching that point in which we're anticipating that we will start to see population level effects.
But you haven't to date seen
No, not to date, but
effects?
we're just embarking upon a research project that if you are interested, I can quickly click through that PowerPoint. We also have, I already mentioned the challenges that we have with carcass disposal and the loss of funding. So those challenges, you know, continue to you know, pose problems for us to this day, but we continue to carry on and continue to do what we can to learn about what we can about disease distribution and prevalence. So we've seen that steady spread of the disease from around those 2 quarters of infection out to the fringes. We have identified 17 total positives outside of that former CWD management zone. So, and they're kind of, you know, aligned with the Wisconsin River Valley, and then there's that one up in northwestern Wisconsin. The population impacts, I know you guys have asked a few times about, so this is the graphic. I would draw your attention to, I guess, the point in 2002. You know, that was where we had the highest population, and that was right, you know, around the time of detection of CWD, and when we started implementing our strategies. Obviously, things started to go down, and since 2012, we've continued to see now an increasing trend across that southern farmland population.
So Tami, I guess this might be a question that you just can't answer, but so you've got this population decline, which means that's what you're shooting for with the management actions.
Right.
And on the last figure, you're showing an increase in prevalence at the same time. And I guess I'm wondering, like, so do you guys have any knowledge of whether or not this population decline that you were after affected that increase? Like, would the increase have been faster if you weren't doing this, or did the increase, or did these actions have an effect on CWD prevalence or spread?
So that slide that I had earlier on in 2006, where it showed that we had an effect, we were removing more positive deer than the hunters were, and we were removing more antlerless deer than hunters were, is definitely something that we were hoping to see and wanting to achieve, and we believe that that was driving that, along with all the other hunter participation and extended seasons, etc. If things could have continued along that pathway, you know, this line probably would have continued to go down. But the bottom line is, you know, ultimately, as public support kind of waned for the necessary measures that you have to put in place for responding to disease in a wild deer population, you know, we kind of need to be responsive to that public sentiment, and ultimately, in the end, the medicine was too hard to take, I guess.
I get that, and it's not going to be any different here.
Yeah.
But I do wonder that during the years that you were able to do that, you know, when it was, the focus was on disease management, where you wanted to at first eradicate and then control the spread, and you were doing the actions that people eventually said, no more of this. Were you effective at limiting or reducing prevalence, or not reducing, but slowing the growth or slowing the spread?
Yes,
Okay.
we were.
You were.
Oh, let's see. So, I guess, you know, I'll just say on this slide, you know, adapting to changes is the name of the game when it comes to dealing with CWD management and trying to strike that balance between what we want to do as resource managers and what the public is willing to accept. We also, you know, with the changes in time over, you know, we have seen a pretty drastic change in our CWD sampling, going from the bars are basically the samples that we've collected over time, and you can see clearly that there's been quite the decline in the number of samples that we've been able to collect. But yet, even with that reduction in the number of samples, we're seeing an increase in the number of positives that are being detected on an annual basis. So we've evolved from, you know, a time in which, you know, we sought to have a goal of disease eradication to now a time of we're just trying to minimize the distribution and prevalence. And a lot of the tools that we have in our toolbox we're not able to utilize any longer, and a lot of those extended seasons are no longer available. So this brings me to the most recent Governor Walker's initiatives that he announced back in May of 2016. About this same time last year, there were two legislators in Wisconsin that really started to had a pretty large public outcry about the state of CWD in Wisconsin and the fact that not enough is being done, and definitely got the attention of our governor, who then announced in 2016 these initiatives for CWD, focusing on you know, what's CWD management going to look like in the future. And so, seeking input from CDACs. CDAC stands for Citizen Deer Advisory Committees. We have one of these in every county of the state. This is a new outcome of our Deer Trustee Report implementation process. So we were to go forward and seek input from the citizens of Wisconsin using those CDAC committees as the venue for that to occur. He also made a call for a comprehensive study of deer population dynamics, which is just started this winter in that southwestern core area, looking at two areas of CWD prevalence, one high and one low, to just, in part, it's a multifaceted research endeavor, but part of it is to look at CWD and what its effects are on deer population growth. And then he also, is requiring more frequent fence inspections. The whole interest in urine-based sense and supporting the ETA initiative. And then also, once again, CWD testing turnaround time is a point of interest.
What's the EPA initiative you just referred to? Did I miss that somewhere?
EPA initiative?
How about urine-based sense, you said?
Urine-based, BMP.
Oh,
Is that right?
didn't you just mention EPA? You said an EPA initiative? Or did I mishear
I
that?
don't think I did.
I think you said,
No.
I think you said supporting that whole ETA initiative.
ATA.
Oh, ATA.
ATA.
Sorry.
Oh, okay.
Archery Trade Association,
Okay,
ATA.
all right. Yeah, that was my ear.
Like, what? So this developing quicker test results, I would just say there is that, you already know that we're at 9.6. Now, a way for us to get at this is we're going to undertake a Lean 6 process, which I don't know if you know what Lean 6 is, but in short, it's a process by which you seek to identify any
efficiencies that can be gained, so we may or may not identify further efficiencies, so time will tell, but if we do, great, and we'll implement them. So, so on top of that governor initiative, we also were at the 5-year break of, okay, we've got 5 years of the first 15 years, it's time for us to review those first 5 years. And our Natural Resources Board directed us to do that, and so we had already started or well on our way in planning that process internally when Governor Walker announced his initiative. So we kind of had two things occurring in parallel. And so we then undertook this is just a quick review, you've seen these before. These are our 6 objectives. And we undertook this internal review process in the summer of last year where we identified some key successes, even though, I mean, obviously what I just presented to you is a very challenging environment with a very serious disease. But we were able to act upon most of our action items in our plan in some capacity. We believe that we've done a good job in addressing the needs of our customers and identifying cost-effective strategies, and then also prioritizing how it is that we approach disease surveillance and monitoring the intensity and distribution. But yet, obviously, we still see the number of CWD positive detections increase, and our funding limitations and those social, political factors that have influenced our ability to fully implement the plan. So that's something, so we haven't been able to effectively respond to CWD. So then, to get at the governor's initiative, we did form a new citizen process that just started last fall. This time around, we worked collaboratively with our Department of Agriculture and also our Conservation Congress. The state of Wisconsin is the only state in the nation that has a Conservation Congress. What they are is a citizen body. Every county of the state has 5 citizen delegates who then who report to an executive council. That executive council then comes to the Natural Resources Board in tandem with the department staff as we go forward for policy recommendations. So we may come forward with our recommendations on deer quotas or bear quotas or whatever, and Conservation Congress would come alongside us with their recommendations. And ultimately, our Natural Resources Board considers those two inputs in their decision-making process. So between the chair of the Conservation Congress, our state ag veterinarian, and our agency, we formed a sponsor team who then identified a team of 18 citizens representing various interests to serve on a review plan process. We had a really short timeline to do it under. We started in October and we presented our recommendations to our Natural Resources Board on March 1st. Those CDAC meetings that I mentioned earlier, that citizen process for every county of the state occurred in January. We also had a corresponding public survey to inform. And this is basically, the citizen, this group took our first 5 years, took our objectives and action items, discussed them, identified should they continue, should they discontinue, what are the new action items. And in the end, ultimately I'd say that it kind of reinforced that the plan that we have is a good plan, and we have good objectives and action items, but they did identify a few new ones, which I think I'll just highlight those because I'm way over my time. We are working with adjacent states on CWD as a new action item only because in the action plan it specifically just identified work with the state of Illinois. Where now we're going to seek to and we actually have an MOU with the state of Illinois on CWD, so this would work to review that, re-up that, and also look at establishing MOUs with the other adjoining states. Let's see, and then the other new action item that I already highlighted was the whole CWD, the double fencing. for CWD positive facilities. Similar to, I think, what was referenced yesterday with Montana, we only have authority over fencing of white-tailed deer farms, and so if something like that were to transpire, it would be, our initiative to make that happen. But also our Department of Agriculture just identified recently too that there's rules that they're currently in the process of revising that could help support that initiative, which is a really good thing. So I think this collaborative effort has worked well for us, and so we're now gonna, we just had a sponsor team meeting the week before, just last week, to start working on implementation of these new action items. And the other new thing that's come out of this is that we are now going to be reporting to our Natural Resources Board on an annual basis. That's not something that we were doing previously. So I think it's going to keep CWD, in the forefront in the years to come. So I guess I'll stop there since I'm 15 minutes over my time, and I did have some more information on that CWD research project, but I'll save that for later.
Can you email your PowerPoint presentation to us?
Sure.
Great information.
We can get it, you put it on the desktop there, right?
I did, it's already on there.
So if we can, we'll figure out how to get it to you.
If that's all right with you, do that.
Yeah, I think that's fine. Probably, yeah. The only thing I would think is maybe with all the notes that are in there, maybe I should send you a copy with without the notes on it.
Yeah, we'll have to figure out how to get it, because it might be too big to email. So we might figure it out.
Thank you for your patience and letting me run long, and I know it was a lot of.
You condense it into a PDF.
I'm sorry?
The website URL.
Oh.
On the last slide.
Question for the biologists in the room, I guess, just as a general statement, can you compare the home range of white-tailed deer to mule deer? It's greater, mule deer is
Not
greater.
where you are.
It's really different across the state.
Yeah, it depends obviously a lot on environment and,
Mule deer tend to be quite a bit larger in terms of
Yeah.
range.
Okay, I think-
If they migrate.
Tim, it really ranges from, like in southeastern Montana, we had mule deer that spent their entire life within, 25 square kilometers.
Right.
They weren't migratory. Like on the prairie, they just lived there.
And the Bitter Creek,
Bitter Creek, they went 80 miles into Canada. We've had, like on the Judith River, we've had animals that actually, in the Little Belt Mountain Range, that's where they winter, and then they summer here in the Bridger Mountains, which is, 90 miles.
They summer where?
I know it's
In the
very
Bridger
similar.
Mountains right here.
really?
Yeah.
Somebody in
So
Wisconsin.
some of them are migratory and have a huge
Well, I
range,
know
and
about
some of them
fencing anyway.
live free.
whereas I don't think you could find,
So we'll see where
would
that
that,
goes.
you look at migration, especially in Wisconsin, it just kind of makes sense.
I think Justin too, the southeast Montana deer